Talk therapy, also known as psychotherapy, is a form of treatment for all kinds of emotional, psychological issues and problems. Anxiety and depression are two of the most common things that we see in psychotherapy. Sometimes simply having a safe place to come and talk with someone who you trust or have some sort of a positive relationship with, or who listens fully, is in and of itself therapeutic and helpful. Other times there are techniques that therapists use that help de-intensify the symptoms, make people feel better, and in certain cases eliminate the symptoms completely. There are many different types of practitioners that practice psychotherapy, so I think it can be a little bit confusing to the general public. There are counseling or clinical psychologists that practice psychotherapy, licensed clinical social workers, licensed mental health counselors, licensed marriage and family therapists. There are also still some psychiatrists that do talk therapy, although the bulk of psychiatrists just do medication management now. Probably the most important factor is the relationship that you will hopefully have with your therapist. As a matter of fact, the research shows that that is the #1 aspect in the success of the therapy, whether or not the therapy will be effective, is do you have a positive relationship with the therapist? So you do want to shop around until you feel you found somebody who you're comfortable with, who you feel you can be yourself with, open and honest, and share whatever it is that you're thinking and feeling, and someone you feel is fully listening to you and respecting what you're saying. Talk therapy is completely confidential. When you enter a therapist's office, by law, everything that is said in that room is 100% confidential and can never be shared with anyone. The only exception to that is if you present some sort of danger to yourself or to others. We are required by law to then keep you safe and notify the appropriate people. Otherwise, everything you say is completely confidential. That is not true at all. First of all, I don't consider anybody to be crazy. We're all human beings. None of us are perfect, and we all have issues to varying degrees. So psychotherapy really is for anybody who is experiencing anything troubling to them. Most therapy is short-term. There are exceptions to that. There are people who have to be in therapy long-term. But most people should be able to go to therapy for a shorter period of time. That could just be anywhere from a few sessions to maybe a few months of therapy, and then see some real positive results and get into a place where therapy becomes much more optional. If you are experiencing symptoms of anxiety or depression that are troubling to you, where you know that you are not functioning as best as you could function, or you're not living your best life, I do highly recommend that you consider psychotherapy. Go do a little research, find a therapist, go for a consultation, and explore this type of treatment that can really be very helpful and life-changing.